Good afternoon, everyone, and thank you for attending today's Journal Club, which is sponsored by the American Thoracic Society's Allergy, Immunology, and Inflammation Assembly. My name is Nick Hogan. I'm an assistant professor in the Division of Pulmonary and Critical Care at the University of California, San Diego. Today, I'll be co-moderating this session with my colleague, Dr. Amit Berry, who's an instructor of medicine at Washington University in St. Louis. And today we are delighted to be discussing the paper entitled Dupilumab versus Omalizumab in patients with chronic rhinosinusitis with nasal polyps and coexisting asthma, EVEREST, which is a multicenter randomized double-blind head-to-head phase 4 trial and published this past year in the Lancet. We're very fortunate today to be joined by first author, Dr. Eugenio De Corso, who is an ear, nose, and throat specialist and professor at the Gemelli Hospital Foundation in Rome, Italy. Dr. De Corso is an accomplished physician scientist, and his research interests have spanned the field of rhinology, with a particular focus on type 2 inflammation and its role in diseases including allergic and non-allergic rhinitis and chronic rhinosinusitis with nasal polyps. Dr. De Corso has contributed to well over 100 peer-reviewed publications, including numerous clinical trials involving the use of biologics in severe uncontrolled CRSwNP, including that which overlaps with eosinophilic otitis media. And we're very grateful that he can join us today to discuss the EVEREST trial. We're also very fortunate to have two expert discussants joining us today. First, Dr. Ayobami Akenroye, who is assistant professor at Harvard Medical School and Brigham Women's Hospital in the Division of Allergy and Clinical Immunology. Also an accomplished physician scientist, her research interests center on the utilization, safety, and effectiveness of monoclonal antibody therapies for asthma. In particular, she implements epidemiologic approaches to assess comparative effectiveness of respiratory biologics. And this extends to the use of multi-omic strategies to identify response biomarkers for these targeted therapies. And second, we're also delighted to be joined by Dr. Juan Carlos Cardet, who's associate professor of medicine in the Division of Allergy and Immunology at the University of South Florida. Dr. Cardet is also an accomplished researcher in the asthma field, both in the clinical and translational spaces. His work is focused on improving our understanding of severe asthma pathophysiology, as well as identifying novel therapies. And this extends to impactful work by his lab on the role of RGS gene variants in both the risk for asthma and asthma attacks. Now, throughout the session, for all of you joining us, if you have questions for the presenter, you can place them in the Q&A session, and Amit and I will help curate those questions and can ask them for you during the discussion section. And also during the second half of the presentation and discussion, you can feel free to raise your hand to ask to be unmuted and ask your question directly if you'd prefer. And with that, I will give the floor to Dr. De Corso, and we look forward to your presentation.
Thank you, Nick. Thank you, everyone, the panelists. I'm very honored to give this talk tonight. I'm very proud to present you this paper that was a very good, successful paper and manuscript. But before to start with the presentation of EVEREST, I would like to do a background and why we decided to do that trial. Probably many of us, you know that now we are more biologics available for the treatment of nasal polyps, and especially for the severe uncontrolled one. And actually, in many countries, Dupilumab, Omalizumab, and Mepolizumab are approved and reimbursed. But probably in the next year, we will have more. And Dupilumab was recently published the phase 3 trial, and it was approved as well. And Dupilumab is going to be approved as well. Bernalizumab failed. So there are multiple choices now for the treatment of the disease, and there is also the fact that we can use as well surgery.